the thyroid has a whole bunch of moving parts, meaning it's like a Swiss watch. Every part has to be working well, and there's a bunch of different components to it. But I think the number one thing that I would say, a problem for us in managing the thyroid has to do with iodine.
From the Weston A. Price Foundation, welcome to the Wise Traditions podcast for wise traditions in food, farming, and the healing arts. We are your source for scientific knowledge and traditional wisdom to help you achieve optimal health.
Hey guys, I'm your host, Hilda Labrada Gore. This is episode 194, and our guest today is Ronda Nelson. Dr. Ronda Nelson holds a PhD in holistic nutrition, along with a master's degree in herbal medicine. Her expertise includes supporting hormone health, particularly thyroid and adrenal function. Have you noticed how conditions like Hashimoto's and hypothyroidism are on the rise? These can lead to all kinds of health complications like stunted growth, weight gain, fatigue, and even infertility. What causes these thyroid problems and what can we do about them? Today, holistic nutritionist and master herbalist Ronda Nelson offers insights on how the thyroid works, how to heal it using nature as our guide, and why it's important to look beyond the symptoms when health problems arise. She discusses the role iodine plays and what toxins we should take care to avoid to shore up our hormone health. And she also tells the dramatic story of how her daughter's diagnosis of terminal bone cancer led her to some important discoveries on how to best help our bodies heal. Before we get into it, a quick shout out to our sponsors. Just in time for chapped, sunburned lip season, Vintage Tradition has come out with 4 great flavors of their tallow balm that you know and love in a convenient tube: Citrus Shine, Peppermint Stick, Vanilla Bean, and Totally Unscented. Protect your lips naturally at vintagetradition.com. And for a limited time, get 10% off your entire order with coupon code PODCAST10. And Ancestral Supplements. Bovine tracheal cartilage with liver by Ancestral Supplements, putting back in what the modern world has left out. New Zealand-sourced nose-to-tail organ meats and bone marrow in convenient gelatin capsules. Our family cannot get enough of these supplements, and they are based on the ancient wisdom of like supports like. Order yours today at ancestralsupplements.com. This is Holistic Hilda, and you're listening to Wise Traditions. Welcome to Wise Traditions, Ronda.
Thank you for having me. I'm really excited to be here.
You were telling me before we started recording about a client of yours, a patient of yours, who was a veterinarian who had a serious thyroid issue, and no matter how many meds she took, she couldn't resolve it. What was going on with her?
Yeah, she was such a great case for me to work on, because what happened was she had come in and she, obviously had a good understanding of her own body and physiology and how the thyroid works. And she had tried everything. She had Hashimoto's, which is the most common autoimmune condition in the United States currently. And she had just tried everything. So when she came to me, she was on a thyroid medication, Synthroid, and she was taking just a litany of supplements. And I said, okay, you're like the little boy with a gun, with a little BB gun trying to shoot into a field. You're just hoping you're going to get something here. We need to pull back, target, and let's go figure out what's driving this autoimmune/thyroid response. So after a lot of inquiry into diet and cross-reactive foods and, grains, the grains that might be cross-reacting, I realized, and because she was a vet, it already kind of tipped me off, but I realized that she probably had contracted something from one of the animals. And it was either viral or bacterial, some kind of infection, so to speak. And sure enough, when we ran the blood work, out comes this virus. And I said, there's the problem right there. So what we did was we had to address the viral issue first before we could get the thyroid to resolve. And as soon as the virus was gone, as soon as we ended up getting rid of it, her thyroid started to respond remarkably. And within 3 to 4 months, we had the autoimmune piece toned way down. We had her decreased on her Synthroid, and she was feeling remarkable. And it was just because of the virus. So, thyroid conditions We often think it's just Thyroid, or I just need a little iodine, or I'm just going to take grain out of my diet, when there's so many more moving pieces. And this is one of the key ones that I see with patients, having to do with some kind of a viral bacterial load. There's something up with that. And I think it's a piece that we often miss.
This is fascinating. I think the whole way you're approaching this, and you were talking about cross-reactive, like you are a detective looking for what's going on in the body beyond just trying to recommend a certain medication or something.
Yes, I am. And here's my biggest complaint, I say, with my peers. And this is this. We all are in this together, clinician to clinician, in trying to help the patient achieve their optimal state of health and wellness. So everybody's got the same end game in mind, but here's the problem. We've been so indoctrinated by this, and I don't know how else to say it, but it's kind of the Western conventional medical way of thinking, which is you have a symptom, I give you a supplement. You have another symptom, I give you a supplement. You have hypothyroid, I give you Thyroid. You're tired, I do this. If you have hemorrhoids, we give you this. If you have headaches, we give you this. And that's the completely wrong way to go about it. What we have to do is, as you said, be a detective, but even more important than that is we have to look at the body as a whole. All the pieces, the dots will always connect. A good clinician is going to be able to paint the picture and create the dot connections and explain to the patient, this is why your dots, all the dots are the symptoms. This is what they all have in common. And sometimes clinically we don't know what that is in the beginning. You kind of just get information, and I plot another dot, like, okay, we have headaches and they're around the cycle. Okay, there's a dot. And we have constipation. Okay, there's a dot. We have dry skin. There's a dot. Ooh, a couple of those are thyroid. All right, let's just see if the rest of this picture adds up. So you're right. It is such a detective mindset, but it's not just you have a symptom. It looks like a thyroid case. So here's some thyroid stuff. Hope that works. It's never that simple with anything, not with hormones like sex hormones or adrenal dysfunctions or, digestive disorders. It's never that simple. It's always about looking at the really big picture and saying, okay, how do we rebuild this broken house? How do we rebuild it from the bottom up? I always say it's kind of like if you lived on a cliff and you had a beautiful view of the ocean, of the Pacific Ocean. You lived in San Diego, and the cliff starts to slide. And your house starts to kind of sag on the cliff side. The back side of the house is great, but the front side is sagging. Pretty soon my bed starts to lean sideways because the house is falling off the cliff. What we do in medicine is we want to prop the bed up so the bed is straight, but the rest of the house is falling off the cliff.
Right.
So what we want to do is go in and go, okay, wait, time out. What do we need to do first with the cliff? Let's shore up the cliff. Let's keep the erosion from happening. All right, now we can make sure that the house is not going to go anywhere. All right, good. Now the house is not going anywhere. Now we can fix the damage to the house from the little bit of shifting that's happened. So it's just a completely different perspective. But a lot of functional medicine practitioners are that, symptom supplement, symptom supplement, symptom supplement. And I don't think that's the best way to serve the patient.
So Rhonda, how did you break out of that cycle? How did you get this different approach?
Well, it's a long story. Here's the Reader's Digest version. In 1993, my oldest daughter was diagnosed with terminal bone cancer at 10 years old.
Oh.
And at that time, I was involved in accounting, small business accounting. I was the one that rescued people that had all their receipts in a shoebox. And I had done that for years and years. And then you have a life-altering event like that. And I said, okay, I said, something's not right, because the only people that should have cancer ever are old people, 80, 90, 100. I get that, but not a 10-year-old. So what the heck? So I started to I put my brain in high gear. And besides that, I'm talking about my child here. So, don't mess with me. I'm going to figure this out. And what I realized was that all of the culmination of that happened because of diet. And that was a big pill for me to swallow way back then. But I grew up eating Kraft macaroni and cheese, hot dogs, and peas, and that was a complete meal for us. We ate lots of Spam. We ate Velveeta cheese on everything. And my favorite food in the whole wide world is mint chip ice cream. I should say was, because I don't eat it now. But that was my favorite food. That's my favorite food group. Top ramen, 10 for $1.
Yeah.
And that's how I fed my children, because I didn't know any better. And I lived in a tiny little town. I really, truly did not know any better. And I ate only sugar with her when I was pregnant. I was highly addicted to sugar. And so she fell out of a tree when she was 6 years old, broke her arm, compound fracture, had to have surgery. We reset it. And 4 years later, guess where the heart of that bone tumor was?
Right
exactly there. At that break. And it's because her little body did not have the nutrients or the foundation. Her house was sliding off the cliff, but she didn't have the foundation to be able to heal that bone correctly. She didn't have the nutrient foundation. And I went, that's it. It's in the food. So I then began this diligent pursuit of how we eat, what makes up a good diet, and everyone's unique, variability. So what one set of foods is going to work great for one person, but there's going to have to be some alteration of those foods for the next person because of the state of their digestion or their GI health or their lifestyle or whatever. So it's not a one-size-fits-all in many ways. I mean, obviously we know the value of good, healthy fats and, good quality animal protein. Those things don't change. But there's always going to be that variability. So I went back to school. I got a PhD in nutrition. I have a master's in herbology. And I took every kind of education that I possibly could to try and learn how to help other people, specifically other clinicians, to be able to, get their head around the idea of being a whole, right? The whole person, not just the symptom. It's not just the thyroid. It's not just your, libido. It's not just constipation. There's something's wrong with the whole. So the end of the story is today, my daughter is going to be 34 in a few weeks. She has 4 children, and we've had a bit of a bumpy road. She was just diagnosed with congestive heart failure because of some of the chemotherapy meds. But I did a bunch of diet and alternative stuff with her, and her prognosis for survival was less than 10%. So we beat it. We won, and she's still here. So food makes a difference. It always, always, always makes a difference. And she's like living proof of that.
Well, it's beautiful how you really were this mama bear, just really putting all systems go into looking into what the problem was. I'm just thinking of any moms or dads who are listening right now who may have their child diagnosed with cancer. Some would want to fight what you said was the problem. They would want to say, wait, no, our diet has nothing to do with it. What brought you to that conclusion? Was it indeed your studies?
That's a really good question. And I don't know how much of it was just kind of some, I don't know that I have the 100% answer for that. I just instinctively, I think I knew when I realized the connection between the aha moment that happened when I saw the x-rays of her fracture when she was 6 and the compound fracture, and we overlaid it with the x-ray from the heart of the tumor.
Yeah.
Like same bones, we overlaid them and went, oh my gosh, this is because that fracture didn't heal.
Yeah.
And then I said, okay, then why does a fracture not heal? What does the body need to heal a fracture? So I think for me, great question, but I think it was a little bit more of a roundabout way to kind of find my answer. But I was determined. The other thing that was a factor for her, when I had her, I weighed about 200 pounds. So I was a good 80 pounds overweight.
Mm.
And I ate nothing but sugar during the whole pregnancy. So labor was tough. I wasn't able to nurse her. She was horribly colicky. My favorite food was milk and mint chip ice cream and a few other sweet, wonderful things. And when I cut those out of my diet, the colic stopped, which was interesting. I went, look at that, food and the symptom.
Right.
It goes together. You can see it. It really was a huge learning curve for me.
Yeah.
So I'm very, very, very passionate about diet and outcome. What you eat is who you are. We have the most control over what we eat with our health.
Coming up, Rhonda explains how the thyroid works and tells us how low and slow iodine supplementation can help solve thyroid issues naturally.
You're listening to the Wise Traditions podcast from the Weston A. Price Foundation. We pause now to recognize our sponsors.
Hey, you guys, we want you to join us at our annual Wise Traditions Conference. It is the place to be to enjoy nutritious food, learn healing wisdom, meet friends, and be inspired. I've been to other health conferences, and honestly, I can tell you the Weston A. Price Foundation does it right. I wouldn't miss it for anything. So plan on joining us this November 15th to the 17th, just north of Dallas, Texas. Go to wisetraditions.org to sign up today. And you guys, there are lots of ways to make it affordable, including room sharing and volunteering for part of the experience. So just go to the website and click on cost savings for details. Do whatever it takes, just get there. The Wise Traditions Conference, where ancestral wisdom meets modern science. And ancestral supplements with bovine tracheal cartilage with liver. Ancestral supplements offer New Zealand-sourced nose-to-tail organ meats, bone marrow, and bovine tracheal cartilage in simple, convenient gelatin capsules. The life's work of Dr. John F. Pruden showed that bovine tracheal cartilage had unique and powerful effects on wound healing, immune conditions, joint health, and other conditions considered to be treatment-resistant to conventional therapies. All of these conditions were immune in nature, with the exception of the wound healing studies. According to Dr. Pruden, bovine cartilage closely resembles fetal mesenchyme, the primordial tissue from which muscle, bone, tendons, ligaments, skin, fat, and bone marrow, the heart of the immune system, all develop. Bovine tracheal cartilage provided concentrated amounts of connective tissue, immunoregulators, and cartilage building blocks that are now missing from the modern diet. So visit ancestralsupplements.com to see what they can do for you. Ancestral Supplements, putting back in what the modern world has left out. This is Holistic Hilda, and you're listening to Wise Traditions. I loved hearing that whole story because it really does give us the big picture of what's informed who you are today and your approach to health. So let's go back to the thyroid. First of all, can you just back up and tell us what is the function of the thyroid in the body? Give us a big picture, and then we'll talk about how to treat it naturally.
Okay. So the thyroid is what has been long known as the master gland. And there are other glands that are, I believe, just as important in their relationship to the thyroid. But the thyroid governs three very general, broad things: growth, metabolism, and reproduction. So growth, metabolism, and reproduction. So growth as in your height. So we know that in some countries, when there's insufficient iodine in the diet, there's something called cretinism. And cretinism is just very, very, very short people. They just don't grow tall. So growth. Second one is metabolism. Well, anyone with a thyroid issue that has an issue with weight, weight coming on and they're not able to get it off, can say, yes, I get that about metabolism. But it helps us be able to generate energy from the food that we eat inside the cells in these little things called mitochondria inside the cell. So thyroid hormone has a direct impact there. And then reproduction. So thyroid governs and has a really strong correlation with fertility, reproduction, and the sex hormones. But it also has a very strong relationship with our adrenal glands and the production of cortisol and adrenaline. So I call it the endocrine triangle. And I talk about that in my lecture, but this endocrine triangle, if you think of a triangle, you have the adrenal glands on one lower corner. You have the sex hormones, so that would be like the ovaries or the testes, male or female, on the other bottom corner. And then the thyroid sits at the top of that triangle at the very top point. And just like a triangle, you can't affect one without affecting the other two. Mm-hmm. So anything that I do with adrenals is going to have an effect on the thyroid and the sex hormones. Anything I do with the thyroid is going to affect adrenals and sex hormones negatively or positively. So the thyroid is called the master gland, but I don't know, it's a master gland for sure, but it has equal shares in relationships with other glands that are equally as important in what they do.
Interesting. I like that triangle picture you painted. You can't tweak one thing without affecting the other, or have one wiped out, without it impacting another function in the body. So how can we shore up the thyroid naturally? How can we avoid being in this position where we might have an autoimmune condition or fatigue or weight gain or difficulty with fertility? What are some things we can do?
Well, the thyroid, as we were talking about earlier before we started today, but the thyroid has a whole bunch of moving parts, meaning it's like a Swiss watch. Every part has to be working well, and there's a bunch of different components to it. But I think the number one thing that I would say that's a problem for us in managing the thyroid has to do with iodine. So there's two schools of thought with iodine. One school says go high, go hard, or go home.
Mm-hmm.
Go big high doses, and you're going to replenish the body with all this iodine with a high dose. I am not in that camp, and I'll explain why in a second.
Mm-hmm.
The other side is where I am, which is that lower dose of iodine. I always look to nature for the clue. Always look to nature for the clue. So how does the food or the nutrient occur in nature? That's how we're designed to eat it.
Right.
So we look at vitamin D, for example. There's not vitamin D in most of the veggies that we eat and fruit that we eat. But we do get it in fish, and we get it in fish oil, and we do have it in, there are some places that we can get it, but we're meant to synthesize it too with the skin from the sun.
Mm-hmm.
So we don't need to supplement high doses of vitamin D. It's the same with iodine. How does iodine occur in nature? The only way we get iodine really is some plants and, animals have it because of the content in the water and the soil and it's in the grass. So we're going to have little tiny bits like salt, good sea salt has a little bit of iodine, but you never find high doses in nature.
Ah.
It's from a plant. It's from sea vegetables. And you either have to swim out, dive down and harvest them, or you have to get the vegetables that live on the shore, the seaweed that's close to the shore. So when the water comes in, it nourishes and feeds the seaweed. The seaweed's able to extract those sea minerals, concentrate them, and then we can eat that seaweed. And that particular seaweed is called bladder wrack. Bladder wrack. Bladder wrack, the seaweed, has got a nice, gentle amount of iodine. So I always think, look to nature. How does it show up in nature?
Right.
The problem for us, and that's why I don't agree with the high dose, go high, go hard, or go home
Mm-hmm.
philosophy, because I don't think our bodies are wired for that. That's not how it shows in nature. So our risk is, today, I think the biggest risk is the other competing compounds or chemicals are really toxins that will compete for iodine in the body. And those are the halogens. And it's a family of halogens. So be like, my name is Ronda Nelson. Nelson is my surname, and there are 4 people in my family.
Mm-hmm.
And I'm the boss. I'm the boss. And I'm the one that I'm like the iodine. I am the one that should have primo possibility of hooking into whatever receptor I want. I should have a carte blanche to be able to do whatever I need to do in the body.
Mm-hmm.
But what happens is we are drowning, literally, in a sea of these other halogen chemicals, which is chlorine, bromine, and fluorine. And those 3 chemicals, when we get them in our mouths, those chemicals bump out iodine, and they hook, and they're toxins, and they hook onto the receptor.
Oh.
So now we end up with a secondary iodine deficiency because we're getting these other compounds in.
So those compounds are preventing you. It's like they are a brick wall between you and the iodine. They're in your way.
Yes, they're in the way. So there is only one way to get these out once you realize that they're in. And the sources, let's talk about that for a minute. Most of your listeners are going to be really well aware of this, but the sources of chlorine are going to be chlorinated pools and chlorinated water, right? So those are going to be your 2 sources. So you can take up an immense amount of chlorine just by getting in a swimming pool. Within 2 to 3 minutes, you've taken in a large amount of chlorine, and no one's ever in a chlorinated swimming pool for less than 2 to 3 minutes.
No, not
but
really.
It's remarkable how much chlorine comes in. So those are the 2 primary sources for chlorine. So it's in water as a sanitizer. The bromine is in any refined flour product. Any refined flour product. And they use it surgically sometimes, topically over a surgery site. They use it commercially. It's in flame retardants. It's in food. It's in canned processed food. And obviously, if we're eating that, really healthy Weston A. Price diet, right?
Yeah.
We don't have to worry as much about the bromine, but unfortunately as well, it's in the air.
Oh.
So I don't know about anybody else, but I know that I'm probably not going to be very successful holding my breath more than a couple of minutes, and then I'm not going to have to worry about it anymore, right?
Right.
So we can't not breathe. So bromine is a risk, and then fluorine, our place that we see it mostly is going to be in fluoridated water or fluoridated, toothpaste and that kind of thing. Fluoride was used by both Stalin and Hitler as a way to dumb down the population and make them not think. So fluorine has a tremendous effect on the mind. It reduces mental acuity and sharpness and makes you kind of a little bit more even gullible, more apathetic, like where you're just a little bit more drawn to kind of believe what people are telling you.
Whoa.
So fluorine has a real strong effect on the mind like that. So those three things, bromine, chlorine, fluorine, we can't get away from them. We can minimize our exposure by making good food choices, but we cannot get away from them completely. So the only way, and this is the good news is that those will absolutely, you can get them out of the body.
Oh my gosh, so there's no way to avoid these. Well, like you said, we can try to minimize them, but what can we do to get them out once they're in? If we can't avoid them, what can we do to throw them out of the house, so to speak?
So the only way to get them out of the house is by putting back in the boss. So the only way that we can do that is by adding iodine back in. So when you put iodine back in, then we can start to push out and basically bump off, kind of like you're in my parking space, get out. That's my space, has my name, you don't belong here, bye-bye, see you later, you're out. And so iodine will start to bump out and, quote, detoxify. I don't really like that word because it's so overused.
Yeah.
We don't have a good understanding of really what that means. So, but really, we're pushing them out so the body can get rid of them.
So now I understand why some people say go high, go hard, or go home with the amount of iodine we take in, because it would seem logically to be wise to get more iodine in to bump those bad guys out, right?
Right. But here's the problem. If you've had an exposure to those bromines and chlorine and fluorine over your life. So I've had patients that have been competitive swimmers.
Yeah.
Can you imagine how much chlorine they have? And they also, coincidentally, will use bromine. Have you ever heard of a brominated pool rather than a chlorinated pool?
No,
So
actually, I haven't.
Yeah. Sometimes people will say, oh, I don't want chlorine in my pool because that's bad for you, but I'm going to use bromine. Bromine's worse.
Oh, no.
Worse. So people will sometimes, like this, the patients I've had who've been like competitive swimmers, I can't give them enough iodine because they're putting chlorine in faster than I can use the iodine to usher it out. And so understand the iodine isn't the shuttle bus that's causing the chlorine to leave or the bromine or the fluorine, but iodine is the one that says, get out of my parking space. Sometimes people get afraid of iodine, and I hear this a lot, and patients will say, I don't want to take iodine, or every time I take it, I feel awful and I'm allergic to it. And I hear all different kinds of things. But the reason that there's symptoms when you start adding iodine is because of the removal of the other halogens. Mm. So if, per se, I've been a competitive swimmer, let's just say, and I start putting iodine in, what's going to happen if I put in a lot of iodine all at one time? What's going to happen? I'm going to start getting those toxins. I'm going to start pushing that other stuff out.
Oh, right. And when that happens, then, of course, you're going to feel bad because toxins are moving and mobilizing all around your body.
Yep, that's exactly right. So we don't feel good. So patients will say to me, I did iodine and I don't feel good. Like, well, that's actually a really good sign. That means that the iodine is doing exactly what we want it to do, but we just need to pull the dose back a little bit because we're just doing it faster than what your body can keep up with. So if the digestive system is compromised, the microbiome is off, or your liver's a little bit, gunked up and not working well, or your skin is, we're not able to eliminate through the skin. We've got a number of ways for things to get out of the body. So what we want to do is find the way to get it out, but we want to let the body choose the way to get it out, but we need to help and work with our body so that we don't push it out faster than it can get rid of. it makes everybody uncomfortable.
I was going to
And
say,
usually it's malaise or just that feeling of generalized fatigue, kind of like when you have the flu, just that, I'm just tired, like everything is tired. You'll get that. And the other most common symptom is a headache, a low-grade headache. Not a migraine, but just that low-grade, like, I wish this headache would go away.
Right.
Those are the two most predominant symptoms, I would say, from too much iodine too fast. So I recommend everyone is on iodine, but slow and low.
Slow and low.
And low.
Gotcha.
So low amounts, very slowly. We're not in a race. This is not a race. We're not trying to win anything here. We're just trying to nourish the body. We're trying to give it what it needs in order for it to be super healthy. And we want to gently escort those bromine, chlorine, and fluorine out. Because remember, I said you can't get away from it. That's the problem. We're breathing it. If you go to the clothing store and you're touching clothing, some clothes will have bromine on the spray on the outside of the clothing. Now you're getting it in your hand.
Oh, my goodness.
We just can't get away from it.
Right.
It's not at, an epidemic level, but it's just there. And it's just enough in our environment. That's why I think everyone should be on iodine. So when we use iodine, the one thing you want to make sure is that both forms of iodine are present. So there's iodine with an N, and then there's iodide with a D. And they're both forms of iodine. The tissues in the body need both forms. So the thyroid needs iodide in order to produce iodine.
Oh.
So we want to make sure that we have both. Breast tissue needs iodide and iodine.
Actually, it sounds like people could benefit from almost like a coach to help them through figuring out some of this detective work, like we were saying, what's going on with the body as a whole, and then to figure out the right levels of the iodine and iodide. And, it sounds very involved, I guess I would say. But you have given us some great first steps in terms of what to do to minimize our exposure to kind of the enemies of iodine and our thyroid function, and how to naturally actually also find iodine in our food. So that's been tremendous.
So, on that iodine note, let me just say this, that the one thing that you can do is look for the seaweed, bladder rack, and it's bladder, like your bladder, and then rack is W-R-A-C-K, bladder rack.
Okay.
If you can find bladder rack, take it. And the other one that's over the counter, you can find it online, and that's Lugol's, Lugol's, Lugol's. And guess what both of those have? They have both forms of iodine. So you're always safe with Lugol's or anything with bladder rack, because in nature, both are there.
So if I eat, I do like sushi, is that seaweed going to help me out?
Yes, it's a sea vegetable. So dulse and kelp and any kind of seaweed or sea vegetable, scallops have a really nice amount of iodine in them, naturally occurring iodine. So we can get it in our diet, or you can supplement with it. And if you do supplement, we're going slow, low. So we want, like, maybe if you can tolerate it, maybe 3-4 milligrams a day.
Maybe. And that should be sufficient. And you can start slow. Like you said, it's not a race, and kind of so a coach would be good, but we can also just kind of experiment on our own and see what how our body reacts.
Yes, absolutely. And if you get that headache or, kind of like overall, I just don't feel good, I'm kind of tired feeling, that's a great sign. That's like you go, yes, I figured it out. I was a good detective. Figured it out. I just need a little bit less iodine in order that I can still get the same result, but I don't have to feel bad in the process.
Well, Rhonda, we are going to start to wrap it up now, and I want to ask you the question I often ask my guests at the end. If the listener could only do one thing to improve their health, what would you recommend that they do?
Well, I think from our last bit of conversation, I honestly would have to say iodine, because there are we just don't have time to cover it all, but it is the one nutrient that we typically are deficient in, and it's because of those other halogens. And the second thing that I would say that's always my favorite is fermented food. So those those are like my two. I don't know that I could probably choose between the two. So I'll give you two, not just one.
That's great. It's a 2-for-1 special today.
Yes.
Well, Rhonda, thank you for your time. It has been fascinating, and I'm sure it's going to help a lot of folks out there. Thanks again.
You're welcome. Bye-bye.
Our guest today was Ronda Nelson. Visit her website, restorationhealth.net. And you can find me on Instagram at Holistic Hilda. And for the show notes for this and every episode of the Wise Traditions podcast, just go to our website, westinaprice.org. And that's it, everybody. Thanks, and see you next time.
Wise Traditions is a project of the Weston A. Price Foundation for wise traditions in food, farming, and the healing arts. The content on this podcast is provided for informational purposes only and is not intended to substitute for the advice provided by your doctor or other healthcare professional. It is not intended to be, nor does it constitute healthcare or medical advice. On behalf of the Weston A. Price Foundation, thanks for listening. We have many free resources to support you on your health journey. Visit westonaprice.org to find podcasts, articles, videos, and more. You can also find a local chapter near you for help in finding sources of great food. We invite you to support the Foundation's mission of education, research, and activism by becoming a member. Thanks again, and take care.